Thank you, Mr. Chairman, and good morning, colleagues. Today we're marking up 17 bills. 17 bills, that's a lot of bills. It's a lot, that's a lot of work products, right? Yes. 11 of which will be included in one package to increase transparency in healthcare, strengthen critical public health programs, and secure access to care for low-income Americans. First, we're marking up legislation to reauthorize the animal user fee programs and overhaul and modernize the nation's organ transplant system. That is a huge issue, and bravo to the entire committee, all of the members on that, because this is something that's really needed. Talk about life or death situations. Next, we're considering a comprehensive package of bills that advance bipartisan efforts to reauthorize and expand vital public health programs, increase transparency for hospitals, health plans, and PBMs, long time in coming, including my bill, the PBM Accountability Act, to reveal the business practices of pharmacy benefit managers that drive up prices for patients. Prevent cuts to Medicaid, disproportionate share hospital payments, and bring down the costs of health care to pay for the provisions of the bill. Something else that's really very important. I'm pleased we're also marking up 2666, the MVP Act legislation that I'm really pleased to have joined the chairman on to codify a CMS rule that ensures that Medicaid enrollees have access to breakthrough gene therapies to treat and cure diseases such as sickle cell anemia and cystic fibrosis. We've worked hard to tailor this legislation to align it more closely with the underlying rule and give CMS the adequate flexibility to update the provision in the future. We're also marking up legislation to establish patient protections on highly rebated drugs and to require HHS to issue an annual report to Congress on how changes in Medicare payment systems impact provider and payer consolidation. The last bill is H.R. 3290. That increases reporting requirements to participants in the 340 drug pricing program. I have some serious concerns about what I view as cherry-picked metrics in this legislation that, in my view, don't accurately represent the program or its benefits, and I plan to vote against it. This markup is a culmination of months of work by subcommittee members to examine some of the most pressing issues in health and to develop solutions, policy solutions that address what needs to be addressed. I'm so proud of members of the committee, both sides of the aisle, and thank you for your leadership, Mr. Chairman. I urge all of us to continue these bipartisan conversations. Most frankly, it makes me look forward to coming to work, because I have great hope that the work is going to really end up in movement. So with that, I yield back.
Thank you. Thank you for your kind words.